Welcome, everybody. I'm delighted to welcome you to our healthcare webinar today. We're going to be discussing how to be compliant and engaging with your member communications. We're going to go through a couple of introductions. I want to share with you a couple of findings that will give you a bit of background as to why we're talking about this today. And I'm really delighted to have Professor Christopher Trudeau with us today, who's going to be our expert speaker on the topic. And as always, we're going to have some time for Q&A. So a little bit of housekeeping. My name is Evelyn Wolf. I'm the CMO here at VisibleThread. And as I said, it's my absolute pleasure to have you all joining us. We'll be on the webinar for about an hour today. Over in your GoToWebinar control panel, there's a question facility. Please feel free throughout the webinar to add your questions in. We will have a Q&A session at the end for about the last 15 minutes or so. As always, for anybody who joins our webinars regularly, if we don't get to all questions, I do try to get to everything at least afterwards if we don't get to it live. So do pop your questions in. There's a short survey at the end of the session. I would really appreciate your feedback. It helps me figure out what session we're going to do next, what you liked about our webinar and what we can improve. And as always, we're going to be sharing our recording in the next couple of days, expected by early next week. I'm aiming pre-Thanksgiving. So without further ado, I'm really delighted today to have Professor Christopher Trudeau join us. Chris and I actually got to talking after a webinar that we did a couple of months ago, where, as always, the question came up, hey, how do we get our legal and compliance language more engaging? How do we make sure, and how do we get our legal team on board even to discuss with us and speak to us about plain language and make sure that things like our privacy policies and terms and conditions and all of that good stuff are actually clear to understand. Chris, would you like to introduce yourself to our audience today?
Sure, yeah, thanks for having me. Hello, everyone. I'm coming to you from Arkansas, which is, I spent a lot of time in Michigan, and I don't know if Joe Kimball is on the line, but he's one of my mentors. Without him, I would not be here now. But since about 2011, 2012, I focused more of my attention on health literacy and kind of clear health communication, and how can we better connect with patients and community members while also complying with regulations. So that's kind of the theme for today, is connecting while complying. Some of you that may follow me on Twitter know that I've done one of the first studies, which you can see in the links on the slides, focusing on the public's perception of legal communication. And in the legal world, there's not a lot of studies like that, but in the health world, there's a lot of funding for these type of things with health literacy and health communication. And so I'll be mentioning some of that today, some links that will help you kind of make the case for clear health communication in your organizations.
Yes, and health is a big piece. I mean, we're talking about health in VisibleThread quite a bit. We ran a health insurance report earlier this year, and this was part of, I suppose, our first conversation, Chris, when we got onto the first call, and you said, I'm not just a law professor, but I'm a health literacy expert, and that got me very, very excited and really glad that we could have this call today, because when we ran our health insurance report earlier this year, we kind of looked at some of the leading health insurers in the US. We looked at Medicare documentation as kind of a data point, a reference point to look at. So it was strong Medicare focus. We looked at documentation available online. These were often PDFs. And we said, right, let's analyze these and let's check, when it comes to Medicare, do the top insurers actually communicate clearly? That was our question for the report. And I'd love to share a couple of the results that we found and see how we might do better in future. So our first key finding was that actually the majority of insurers are not really clearly communicating with those who avail of Medicare, those 65s and over. And it was quite interesting because we were deep diving into a number of different organizations, including the National Center for Education, who looked at health literacy. And okay, this is an older stat, 2003, but it's still accurate, where they found that 51% of adults aged 65 to 75 have a basic or below basic health literacy level. And health literacy, what we're talking about here is not just your insurance documentation, but it could be the ability to understand how to take prescriptions, how to take medication. So our recommendation based on that was that we need to look at a reading grade level of 6 for this age bracket. And based on that, we found that 86.6% of insurers are not using this. They were communicating at a much, much higher grade level. The next thing we found was a lot of complexity, and only 6 out of 30 insurers had kind of an acceptable level of complexity. And an example here, so we always look at plainlanguage.gov. The link is there on the right. We have some great examples of complex language versus simple language. And when we think about something like the patient is required to notify us, this may sound simple as just a sentence in itself, but imagine this as part of a dense 2-pager. How could we make this a lot simpler, especially if this is communication directly to a patient? It could be the patient needs to tell us, or better yet, a lot of the documentation that we were analyzing spoke in third person. So instead of speaking in third person, just saying, hey, you need to tell us. Isn't that a lot simpler than saying the patient is required to notify us? The next thing we found was academic tone by use of passive language. And pulled here are kind of the worst offenders, so to speak. And there's a lot of stuff that we can do and focus on to make language a lot more active. When you use active language, it brings in ownership. It allows people to understand much more easily and clearly what you're trying to convey. And we're saying passive voice levels should be 4% or lower. And as you can see, you know, we're starting off our bottom 10 at 5.1, 5.2, 5.3%. Hey, you know what? There's a little bit of work to do here. This is not a huge amount of heavy lifting that has to be done to get to a strong level of active voice. But when we come to the other side of the scale and we're suddenly looking at, you know, double the amount of passive voice that's recommended and above, well, that's going to be an issue, and there's some work that needs to happen here to make sure that language becomes a lot more active. We also found that there were a lot of long sentences used, and I don't know about you guys, but when I consider long sentences, and I have to, you know, put my hands up, and I think I've said this on a webinar before, I'm one for long sentences. So it is something to look at, because when you start reading a long sentence, by the time you get to the end, you can't really remember what the beginning was about. And when we're dealing with a complex and emotional topic like Medicare documentation, we're much, much better off splitting complex and larger concepts into smaller bite-sized pieces. So we've taken something that was fairly much a standard sentence, and you can see on the left it has 31 words, a grade level of 15.5. I think that puts us into university, and one sentence. And we said, right, what can we do to make that a little bit simpler? Well, let's split one sentence into 3 sentences, and suddenly we have a grade level of 7. Not quite at 6 yet, but overall, with a little bit of work, we could really get it there. So that's just the example there for for the use of some shorter sentences. Our final finding that we had, our 5th finding, was that 2/3 of insurers actually produce content that's a lot harder to understand than Moby Dick. So what we use here is the Flesch Reading Ease Scale, and we split the insurers up. As I said, we had 30 that we looked at, and we grouped them into the bottom 10, the middle, and then the top 10 insurers. Now, the top 10 insurers, you can see them there on the right with a score of 60.8. They're not doing too bad. You know, they're in the green zone. This is getting to a point where it's actually quite easily understandable. Now, when we look at the middle and bottom insurers, and this is again grouped by the results of the Flesch Reading Ease scale, we can see the bottom 10 insurers are closer to an academic paper on chess than they are to a book like Moby Dick. So there's a lot of work to be done here to make sure that communications that are sent out for Medicare patients, and let's, make this clear again, this is for people 65 and over who we're communicating to about something that's, quite an emotional topic. It's about their health, it's about security, it's about, will I be looked after if something were to happen to me in my health? Well, then, you really want to aim at a reading ease level of at least 60 plus to make that as simple as possible. Now, I'm really glad that we have Chris on board here, who's going to share a couple of examples with us. And we have to admit, we've had a couple of technical issues earlier today, and I wasn't able to give Chris the opportunity to share or give him mouse controls. So we're just going to try this again. Chris, if I give you mouse controls now, can you move the screen forward?
Let's see here.
Is that working for us now?
It doesn't appear to be, but I don't have the mouse in front of on my screen, so I think you maybe just took it away. So
let's see, how's this? Sorry about this, everybody. It's Murphy's Law. Once you go live with a webinar, there's always a little technical hitch, and
yeah,
this
no,
seems to be
it's not
ours
working.
today.
You can move it ahead for me. That's fine.
Fair enough. That I will do. So we're going to, I'm going to hand over to Chris now. Chris, really excited to hear from you about how we can do better communicating in health and in the health industry.
Well, thank you so much. I really appreciate. I really liked hearing. That was the first time I've heard the results of your health insurance report as well. So I really liked hearing that because, as I kind of said in the introduction, I've been focusing a lot more on health literacy, and you can kind of move ahead, and I will talk about my disclosures here. So I work at the William H. Bowen School of Law at the University of Arkansas Little Rock, but I'm also the head of the regulatory knowledge and support function of our Translational Research Institute. UIMS stands for the University of Arkansas for Medical Sciences. So I focus a lot of my attention on clear consent. How do we take people who are going to be, subjecting themselves to difficult, potentially life-threatening clinical trials or life-changing clinical trials? How do we take them from introductions like this might be your last chance to really, to maybe help yourself, but to help others in the future, to understanding what it's actually going to happen to you. So that's what I focus on a lot. I'm also on the FDA's Risk Communication Advisory Committee. Now, I'm not speaking on either, on any of these folks' behalf here, and so some of the things I say you'll hear are a little bit controversial, and so it's not necessarily opinions of these organizations. All right, so let's go ahead a bit here now. Now, this is something I thought about a few years ago when I was driving on the road and I saw a sign that said, "Get your flu shot here." And I thought, you know what? Marketers are really, really good at communicating what they want us to do. But then when we get over there and we want to get our flu shot, this is not actually a flu shot consent form. This is the first ever Botox consent form. And I didn't want you to be able to actually read it because I don't have their permission, and I don't like to, I don't like to get into that if I'm not getting permission. But look at that. I mean, who even wants to try and read something that looks like that? So it's less of, words are one part of things, but it's really the interplay with words and design and kind of the flow of how you take people through things. And when we're selling to something, we're really good at that. But then once we get the lawyers and the regulators involved, we tend to do things that look like something like on the right side of things. And that's, I mean, there's examples all over but this is a pretty good one. Now, by the way, the Botox consent form is way better now, but that was the original one. All right, so this is what I often think about. I mean, I'll give you tips, some of the tips, but on how I do things, but really it's how do we make change? How do, you know, a lot of this is that mental hurdle that we have to go through, you know, in organizations to kind of say, okay, this is how we've always done things, or this is what, you know, insurance company X is doing, or health provider Y is doing. So we have to do it too because they must know more than we do. But that's not necessarily true, right? The secret is, you know, is building the new, you know, not fighting the old. And so that's one of my favorite books you'll see on the right side of the screen, is Switch, which is how to change things when change is hard. And what the gist of what I like to focus on in that book is they really talk about, you know, change is kind of three things. It's really, you know, like a rider riding an elephant. So think about somebody riding an elephant. You're the rider is the logical, rational side of things. It's like, oh, I want to go here, and you direct the elephant to go a certain way. The elephant is the emotional side of things, you know. And if the elephant is like, oh, I see a mouse, or I don't want to go that way, you know, the emotional side of things are going to take you, you know, in a different way, regardless of the rational side of things. And so, in really, I like to think about that, and you know, about how that applies to organizational change, you know, in terms of how can we shape the path to get, you know, the logical, rational arguments and the emotional kind of appeal to go in the same direction, so we can, you know, so we can make change that happens a little bit quicker. All right, so that's really what I'll talk about is a little bit on the importance of health literacy. I know Evelyn mentioned some of the stats earlier, which is good. But then what I really want to focus on is kind of the business and regulatory case for health literacy, because that's, again, if you want to get that logical side of things, you know, and the economic and legal arguments for this, you really need to have some ammunition for that. And I'll give you some of that, and then some tips to, you know, that I kind of use when I'm trying to do change efforts, you know, to focus on more on clear communication. All right, so the importance of clear health communication. Let's start with that. All right, so which of the following is the best predictor of an individual's health status? These are all predictors, by the way. So age, income, race, ethnicity, education level, or literacy skills. Well, it's literacy skills. So you can click the animation, Evelyn, and then, so in this study by the that was cited in the American Medical Association, again, this is back in 2003 when a lot of the data came out, you know, the U.S. data came out. 75% of patients who reported being in poor health also tested in the below basic health literacy category. So you might say, well, what do the categories mean? And that's what the next slide is about. So it's not just, we often think of it as grade levels, but you can see on the screen, it's the tests for health literacy in, you know, in all of the various national assessment of adult literacy in the U.S. and then the PIAC, which I'll talk about on the next slide, relate to ability to do things. It's not necessarily ability to read words. It's ability to, let's say, for example, see the basic. Give 2 reasons a person with no symptoms of a specific disease should be tested for the disease. And so in order to get out of that category, you'd have to be able to do what intermediate says, is find the range, find the age range for a child to receive a vaccine using a chart. But look at number 12. So only 12% of US adults qualify in the proficient level, which we normally equate to like high school, college reading level, university reading level. But really, look what it means. It means find information to define find information to define a medical term by searching through a complex document. We all have to do this, particularly in the U.S. When navigating health insurance. So we know that only 12% of people have the ability to do that. But yet every single one of us, whether we're filling out Medicaid or our employer's insurance application or government applications in other countries, have to be able to do these things. And that's the big disconnect, I think, with health literacy and the legal regulatory environment, is we know people can't do these things, but we're asking them to do it, you know, not quite daily, but quite often. All right, so the next one, this is the most recent data from an international scale, from the PIAC, which you can see what it means on the bottom, Program for the International Assessment of Adult Competencies. And they look at this internationally, but I've broken out the US adult literacy statistics here, and you'll see they're a little bit, they went a little bit higher than the National Assessment of Adult Literacy from 2003, but because they put in the non-literate folks, but then also basic and below basic, you're talking 52%, depending on the most recent study, that fall into those basic and below basic categories. So again, like I said, 12%, we're asking everybody to do all of these things. And so that's the disconnect. Now on the next, you see who's at risk. We tend to think, oh, it's people who are, have low education and those type of things. It can be anybody, because you can't really tell by looking, but the ones that are most, the people that are mostly affected, or at least more affected, are those with certain other, other issues, so older adults are 3 times more likely to have below basic health literacy, for many reasons. Of course, it could be, mental capacity fading, or it could be just, education at the time that they were growing up, or it could be just more complicated, things happening in their life that they've never had to deal with before. And so this is where I like to say, and I didn't make this up, it was actually a friend of mine, Cindy Brock, from the U.S. government's AHRQ, which is a healthcare research and quality organization here. She says, health literacy is really a state, not a trait. We tend to talk about it being, disproportionately affecting people in poor health, or, different, race or ethnicities, but it can be anybody. I often think about this, like, my mother is somebody who wouldn't test in the low health literacy category. She'd be in the pretty high category. But when she had breast cancer, she didn't know anything about that, about fixing her port and all of those things, and I didn't know anything about that. And so we're learning, when that happens, you're thrust into this new environment. And so it's really a state, right? Now she understands all of that, but at the time, that's one of the things that you don't know. So that's what I like to think about is, health literacy is really a state, even though it, we know it can be, we tend to think of it as a trait, but it's really not. All right, so let's move on to the next slide. This is my my new state of Arkansas, actually. And this is the health literacy levels by county. So the darker green it gets, the darker it gets, I should just say, the worse in terms of health literacy, people with basic or below basic health literacy category. So this region where it looks like a hockey stick, coming down and then over to the left, that's called the Delta region. So the Mississippi River is right there. Now, if I were to overlay this with all of the other health disparities, mortality rates, economic rates and all things, it would look very much like this. The places that are, that are all white are the places where there's colleges and the population level is higher in those instances. And so we do tend to see that, right, is health literacy clusters based on all of these other disparities that may be out there. All right, so moving ahead now, just kind of that's some of the data behind that. So we know people struggle with forms, and I think Evelyn mentioned some of this. You can click ahead on the animation here. So in one of the largest studies conducted on health literacy, this was back in the mid 90s, and you can see the link here. Researchers found, basically there was a lot of things they found, but for our purposes, that 86% of people did not understand the rights and responsibilities section of a Medicaid application. And again, so we're talking about people who have to apply for Medicaid, so they either have disabilities or they don't have a lot of money, and maybe some other disparities and those type of things. And so they just don't even know what they're allowed to do. And then 60% of people did not understand a standard informed consent form. That's getting a little bit better over time, because again, this was been about 20 years ago, but it's not much better at all. So let's move ahead again. Now, this is something I've been focusing a bit on this year, which is you might know of this as a living will. They're actually called durable power of attorneys for healthcare, or other types of things like that. But this is one of the things I've been creating for our UAMS hospital, is kind of redoing this. This is not the one I did, by the way. But I was looking, as I was doing this, I was looking at the various forms that are out there, and this is the one I found. And I'm thinking, okay, lawyers, we just don't know a lot about plain language and health literacy. So So it just must be some Arkansas lawyer, but you'll see that what just came up is this was drafted by the National Hospice and Palliative Care Organization. Now, this is a patient advocacy organization that's putting out a form like this. And so I have run it through readability statistics. I just don't have a slide on it, but it comes out at about the 22nd grade level. I mean, the reason for that is, look at the second paragraph is just one long run-on sentence with words like pursuant to and proxy and all of these other things. But you'll see why this really matters. On the next slide here, one of my friends at the University of California, San Francisco, that's what UCSF means, Dr. Rebecca Sidori, she's the expert in, in kind of palliative care and end of life decision making and those type of things. Well, this is what she published a couple years ago from her patients. She says this: my mom passed away and she had signed the paper in the hospital, but it was totally wrong because she didn't really understand it. We had another one filled out, and that one said, do you want to be resuscitated? Do you want to be on a machine or not? And then she said no. And then the questions were in conflicts. One said yes and one said no. That really confused us. And it would not only the family members, but what about the providers? And that's what we found here as well, is that if there are conflicts between the forms, then the doctors will do what's best in their medical judgment. They won't necessarily, because they don't know, so they have to go back to the medical judgment. So what happens then, right, is people's wishes are not being followed because they can't understand the form, or many other reasons, but that's one of the main reasons. So I like to think of advanced directives as one of the main use cases for clear legal communication in healthcare, but really it's much broader than that. But that truly is life or death. All right, so that's a little bit, I tend to use a lot of that for kind of the emotional, why do we need it? If you care about people, you should care about this type of thing. That's kind of the, the elephant in, the motivating the elephant on the emotional side. But from a rational legal side, we really do need something that pushes that case forward. And so that's what I'll talk about now. So, and this is a 2015 study from Accenture called Happy Patients, Healthy Margins. So, if you're ever trying to convince some of the accountants or, the C-suite to kind of move things your way, this is good for you. So let's pull the animation up a little bit. But here's some of the, here's a quote from the report. A superior customer experience doesn't just strengthen patient engagement, it also correlates to 50% higher hospital margins. And now the next one, a follow-up to that, is a hospital system earning $2 billion in revenue would have to cut 460 jobs, assuming a $100,000 salary with benefits, to achieve the same 2.3% margin benefit that improving the consumer experience might bring through revenue growth. So if you're talking about trying to improve experience, patient engagement, customer experience, and those things, we know that there's a correlation to saving money. And so that can help motivate, obviously on that side of things. So what about let's see the next slide here. So the SCAN Foundation issued a report on patient-centered care about a year after that Accenture study. And they also found a little bit less of the quantitative stuff, but that patient-centered care results in greater sense of empowerment, a focus on wellness and quality of life, and a better care experience. But what's really interesting is they also showed evidence that it improves the job satisfaction of healthcare providers who prefer to connect with their patients and work together as a team. So, for those of you in the healthcare world and you know about the triple aim or the quadruple aim as it is now, patient-centered care and clear communication, that goes along with that can help all sides of that quadruple aim. And so the next, the next part said, from a U.S. perspective, where we talk about Medicaid and Medicaid payments, a lot of times with Medicare, the hospital gets a certain amount of money, for a hospitalization based on certain diagnosis, regardless of the length of stay. And so if you can use clear communication, patient-centered care principles to shorten the stay, the hospital receives the same amount of money, but has lower costs, and it has a better return on investment. So there's a lot of data connecting, the clear, communication, patient-centered care, experience with higher rates of engagement, and then better better metrics in terms of business standpoints. Okay, So how would, if you could save, think of this is for the insurance companies, folks on the call. If you could save $15 per call, would you do that? I think you would. And so I'm on the round table for health literacy. And by the way, this is a free download if you go to the link. But we published these proceedings of workshops, and this was from about 2 years ago, today, basically, around today, about late November 2017. But we talked about building the case for health literacy. So if you want a lot of stats, there's a really good summary in there. But one of the folks we had talking was this Chris Carlson, who was a VP at the United Healthcare. And basically said, every time someone calls us, it costs us $15 and it takes time out of the caller's day. And so what happened with that, and we can do the next animation, that was the incentive for United Health to focus on clear communication with its customers. It actually has a division called Health Literacy Innovations Department that a friend of mine, Steve Rush, runs. And he's really worked on kind of, promoting health literacy throughout the entire organization. Not only because it's the right thing to do, but because it's going to save them money. And so one of the things, and we don't have to click on the link, but I just thought I would put the link for you here, is this Just Plain Clear glossary that they're creating. They have thousands of words that they're creating, and they've started to translate that into Spanish and Portuguese because they have a big presence in South America. These terms, it's not only insurance terms, but it's a lot of healthcare terms. They're starting to add clinical trial terms. And so they're really doing a nice job with this. And so that's one tip if you're looking for, how do I define, one of these kind of esoteric insurance terms? Well, it's probably there. And if not, they have a process for kind of submitting words that should be clearly defined for future users. Okay. So continuing on, so how about some laws and regulations? We'll get through this part a little quickly. So many government healthcare agencies care about improving understanding. So if you click on the animation here, one of the strategic goals from the U.S. Department of Health and Human Services strategic plan, you can see is to use clear communication strategies to improve the experience of care for patients and integrating health literacy principles to promote patient self-management. So, if you're looking for that type of, kind of policy support, you have it here. And so here's another one. We'll kind of go through this. And so one of the things with the conditions of participation, so hospitals in the US have to follow these Medicare and Medicaid services conditions of participation in order to get reimbursement by Medicaid. And there's a lot of interesting things for the clear communicators in the bunch to take from this. And one of those is this: informed consent requires that the patient have a full understanding of that to which he or she has consented. An authorization from a patient who does not understand what he or she is consenting to is not consent. And so we know from the statistics, a lot of people do not understand informed consent, yet that's a requirement under some of the conditions of participation. So how about the next one? And so it's all over the map, so they have conditions of participation for home healthcare organizations, for all different types of organizations. But one of the more recent ones requires a patient's rights notice that includes patient's right to actively participate, to develop and update their plan of care and discharge and transfer plans. And then you'll see at the next animation, it requires that the notice be written in a language and a manner that patients can understand. And we now know from all of the statistics that we have that means writing at a 6th grade level, a lower level that people can really, that everyone can understand, not just the educated and that have the higher reading levels. So we really could go through a lot of these. Now, for those that, I wanted to add this one in here because I love the quote, but also for those that are not just from the US on the call, but the GDPR really is helpful for our purposes in the plain language movement. It actually says this: the consent must be in clear and plain language for the given individual. And I love this. It says, because it bashes lawyers, and my kind. So when seeking consent, organizations, and that's me adding it in there, should ensure that they use clear and plain language in all cases. This means that a message should be easily understandable for the average person and not only for lawyers. Organizations cannot use long, illegible privacy policies or statements full of legal jargon. So if you want some legal case for why you need to write your privacy policies very clearly, You've got it here. And what I really love is this next one, if you have the animation, is understanding that a lot of children use the internet and apps and those type of things. And so they actually talk about this in one of the working group papers is, given given that children merit specific protection, any information and communication where processing is addressed to a child should be in such a clear and plain language that the child can easily understand. So that's really not talking about reading levels per se, but talking about let's write something that people can actually connect with and understand. Now, the Joint Commission, again, they're the ones that kind of certify hospitals, under the conditions of participation. This was published in 2007, and I love this quote, again, because it bashes my kind, but informed consent forms that are written by lawyers for lawyers do not increase the knowledge of those who, with their signature, are committing to allow the performance of treatments and procedures that may be associated with significant risk. The typical informed consent form is unreadable for any level of reader. So I use this all the time to convince people, like, look, what we're doing is not working well. The Joint Commission knows it. Look at this quote, especially, that kind of resonates with lawyers, because especially if they're not like me, they kind of take offense to it. And they say, let's do better. And so that's a good way of kind of motivating people to change. All right, let's move on a little bit here. Now, for the health insurers on board, I want to talk a little bit about the Wells settlement. So this happened in the state of Louisiana in the US regarding Medicaid denial. So there was a lawsuit basically over a person who didn't understand that their Medicaid was denied and didn't know how to fight that and those type of things. And so this resulted in a lawsuit which was settled. And the settlement requires the Louisiana Department of Health to describe specific reasons for denial in plain language and in sufficient detail to know the denial rationale. And it defines, you can see how it defines plain language here. The use, because the language is concise, well organized, and follows best practices of plain language writing. So insurers, at least United Healthcare, who I've mentioned earlier, have taken this to heart in that way. And actually, you'll see the bottom screenshot on the left side is actually the website that needed to be created because of this settlement to help people comply, the Louisiana Department of Health comply with these new requirements. So, if you're looking for actual things that resulted in some type of cost to insurers and others, you've got them here. All right, so let's move on here. Now, what if your organization's lawyers are still not convinced? And this happens all the time. I mean, I fight with regulators all the time about things. That's one of the things I actually enjoy doing. You think it's I don't know, maybe I've got that sickness in my brain. But anyhow, so I always like to tell folks who are not lawyers this is understand that a lawyer's duty is to protect a client's interest. This is the whole reason we are in business, is to protect our client's interests. Everything else comes second. So when you understand that and accept that reality, that can filter how you make arguments and kind of how you try and convince people to that what you're trying to do will help them do what they're trying to do. And so that's what I like to say. And you can see that with the animations, you can just click through all of them on the screen, is we can serve the client and be clear at the same time. Health literacy and the law are not mutually exclusive. And I'll qualify that a little bit. About probably 95, 98% of the time. There's sometimes where it's like, strategically you're thinking, well, I have to do it this way. And sometimes you're just not going to be able to move the lawyers on this. But that's what I always say. You want that? Fine. Take that. But give me the rest of the document. And so if I can get 95% of that document to be written clearly and in a way, and walks people through it with clear document design, I will take it if 5% of it is not that great. It doesn't have to be all or nothing. So I always talk about health literacy being a sword and a shield. So you can click through the animation so people can read that. But the sword part of health literacy is that we have the research and the regulations now show how important it is, that patients and people are be able to understand things and the outcomes are related to that. And so not adopting health literacy can actually open the door for claims. That's the sword, right? We see that with the Wells settlement, and there's others as well. And the shield part of health literacy is that if for organizations that embrace this and actually try and improve their clear communication, they're actually further shielding themselves from liability. They meet the gold standard. It's even better than the currently accepted practices, because the currently accepted practices don't incorporate these things. So you're talking about, from one of the things about reasonableness and reasonable care and reasonable everything that we think about in the law. That's what the shield does. So the other thing I like to think about lawyers is never assume these things. There's a lot of things never to assume about us, but 3 things that are relevant, related to us is don't assume that we know anything about health literacy in plain language. Some do, some don't. But I think it's a good assumption, to think that most don't know anything about that. We're working on it, but don't assume it. And also don't assume that we're experts on legal drafting. Not even clear legal drafting, just legal drafting in general. Some are for sure, and some are not. But legal drafting isn't a required course in most law schools. Contract law is, but not how to draft them. So don't assume that we know anything more than what the law requires, because that's what we're trained to do, is know what the law requires, but not necessarily all of these other things. And please don't assume that we know anything about document design. Lawyers, at least in the US, still use WordPerfect. Some of them, right? It's like, who has even heard of WordPerfect anymore? Now, Adobe to lawyers generally means a type of native hut, or type of housing for natives, not design products that actually make things look really, really nice. And so do not assume that we know anything about document design. I would say like just a small fraction might know anything. I've taught myself it over the years, but I've had no training really on it other than just my own training. Okay, so moving ahead. Now here's some quick tips to help you convert the reluctant, and then we'll be done. So don't discount the importance of behavior theory or health behavior theory, but it applies in non-health settings as well. We often think of it as just words and readability levels and all of these things, but really clear language, especially in health, is getting people to do things, right? It's activating, it's action language, and marketers know this, and content developers know this, but we tend to forget it as lawyers in a lot of settings, actually. But how do people intend or form that intention to do something and then actually do it? It has a lot to do with their attitudes and the norms, and then their perceived behavioral control. Am I the type of person that eats well, or that fills out forms, or am I the type of person that's just I'm too busy for this, just like everybody else, and so I just throw away the form when it comes in. So if you can work in and just kind of understand behavior theory into a lot of these documents where you're trying to get people to do something, then that can, it takes your writing and your document design to the next level, because then you can think about that. All right, next one. So again, we tend to think of plain language as words, but it's really not words. It's words. It's the interplay between the words we use and the design and the content, creation process, creating this user-focused design. That's how we get to clarity. I mean, we could write a document that's extremely clear from a wording standpoint, but if we don't design it properly, nobody's going to want to read it in the first place. I think about that from a paragraphing perspective, right? If we just put one long paragraph, of all the stuff that's there, even if the individual words are understandable, people won't want to read it. Or if we just use a small font or something like that. So it's really this holistic perspective that equals clarity. And so next slide here. Now this is really for health literate organizations, but it applies to all organizations really, but particularly health systems, insurers, and those type of things. And this is nothing new. The National Academies of Sciences, again, I'm on the roundtable, but I was not at the time, has a report on the 10 attributes of health literate organization. And it's really good on talking about each one of these 10 things. About, the biggest thing, of course, is you have to have a champion, hopefully multiple champions, but you got to have the champion. And then, you can see it. You got to plan, evaluate, and improve. You prepare your workforce. You include consumers in the decisions. you communicate effectively, so when we think about creating this culture for clarity, we have to think more than just the words. We have to think about, processes, training, targeting, kind of forcing, putting more resources maybe to high risk situations and less towards low risk, because we need to prioritize things. And so that's a really good thing, I think, to help. Another good thing is on the next slide here, is this Enliven Organizational Health Literacy Self-Assessment resource. Now, this was developed at Monash in Melbourne, Australia, but it relies on all the global data, so it's very helpful. I find this is really helpful for public health organizations and social services organizations. I mean, it's really useful for other things too, but some of the other sources, self-assessments that are out there, don't actually, translate well to public health organizations and these type of things, but this is one that translates really well to a lot of different organizations. And let's see, I think there's one other one. Let's see, well, I think that, yeah, that was it for timing purposes, so we can get to questions. But to sum it up, the case for health literacy is strong. There's better outcomes for organizations and consumers. There's cost savings and hassle reducers, which is huge. And there's better compliance with laws and regulations. So again, the point of this is what I mentioned earlier. You can see the last animation here is to connect while complying. It's not just one or the other, it's both, and it really benefits everybody. Lawyers and regulators are serving their purpose of protecting their client organization while also benefiting them on the business side and the customer experience side. And so I really appreciate you all, staying on the call, because I tend to, ramble a lot. One of the things I said on Twitter that I would talk about is why plain language is not dumbing it down. Hopefully you now know why it's not dumbing it down, but that's, I think that's one of the myths of plain language, is this idea that it's taking out things that, to make it simple. But it's not really that, especially in the compliance side of things. You can't take out some of the rights and responsibilities that you have a duty to explain to people. So that's why I say, plain language is not dumbing it down. It's taking sophisticated concepts, in my world, the legal world, sophisticated legal concepts, and explaining them to, explaining things to them in ways that people can understand. This doesn't necessarily mean shortening. It often does, but it often means explaining in more words, if you have to use a term like indemnify, what that means. And people will benefit that. And if you want some data for people naturally preferring longer things, if it helps explain things, one of the studies linked on the first introductory slide support that. Either study, either the new one or the old one, kind of supports that point. All right, so now I'll turn it back over to Evelyn. Maybe we can get some questions in.
Absolutely, Chris, that was great. Thank you so much. I know I have a ton of questions,
Okay.
but I'm going to go through these ones here first. So the first question always comes up, will this be recorded? Yes, absolutely, and we will share the slide. The second question, how did we run the data through the Flesh scale? Romina, we've actually used the VisibleThread tools, and I'll share a link to our solution shortly. There's some an additional question, did we remove formatting, long words, headings, etc.? No, we did not. So we look at the text as it was. Here's a question around how does the UK score? And maybe, Chris, you spoke a little bit about one of the help documents that you pulled from Australia. Would you have any idea what the UK score is like in particular?
I do not know, unfortunately.
Okay, fair enough, but we can have a look. So we'll definitely, everybody stay tuned. We can have a look on this. Let's check out here. We've got a ton to get through. So there's another question. In the 2018 study that discussed the costs to an organization, can you explain with examples? So I think, Chris, that refers to when you spoke about the operational costs.
Oh, the operational costs. Yeah, that particular one that I was referencing was it was kind of an amalgamation of things from that from the National Academy's report on the case for health literate organizations. So I didn't create the main report. So what that was, I did speak at that one, and you'll see in that free downloadable thing is that you'll see me kind of my discussion on litigation costs and those type of things. But yeah, so some of the data that you want, like $15 for per call for United Healthcare, and some of the other things that are in the literature are right there. And so that I always use that to kind of cite, say, hey, if you want to see all of the case for health literacy, there's a really good commission paper in this particular download. And so really, there, like for example, the advanced directive project that I've been doing for the hospital here, there's data that shows that uncompensated care goes down when people have when people have advanced directives, but also at the same time, so that helps from the business case, but at the same time, patient and family satisfaction goes up because people aren't going to be getting treatment that they didn't really want at the end of their life. And so that's what I love about the health world, is that there's data galore that you can use to your purposes, because it's life or death type situations in many situations. So I would tell you to go there, because that's where, again, I didn't create the data myself, so I don't want to misspeak on what it actually says.
Fair enough. And I think I'll add to that as well. We've recently spoken to Jack Nelson, who we did a blog series with. To anybody who's interested in particular in the cost aspect, Jack worked, or is still working, should I say, as a top exec in the operations space. And he spoke to us a little bit about potential cost savings through plain language, but also the effect that the reduction of calls into a call center can have on the culture of a call center, the happiness of staff, and of course, how much you actually reduce anxiety levels. Because Chris, you mentioned this earlier as well. When somebody has to pick up the phone and phone a support line or a call center to say, hey, I don't understand what you've just sent me, and it's health related, there is a level of anxiety that comes kind of from the get-go, really, isn't there?
Right. Yep, exactly. And let me also plug, and I didn't get paid for this at all, but and I don't even know if he's on the call, but one of my mentor's book, Joe Kimball, Writing for Dollars, Writing to Please, it has 50 examples, I believe it's 50 examples of folks, or entities that have used plain language and kind of the cost savings and other benefits that they received by doing so. And so that's, again, that is a good collection of more of the legalistic side of things. Not necessarily, I mean, some I think are in the healthcare world, like the Cleveland Clinic, but outside of that as well, for those that are looking for that. So that's, again, I get no commission. It's just, I like the book.
It is absolutely a great book. We're actually hoping to have a conversation with Joe maybe next year. So let's see if we can make that happen. Another question is around kind of the terms and conditions, and this is one that we actually get quite a lot, which is, well, people don't read terms and conditions anyway, so why make them plain language? Why bother?
That's a really great question, and so that's where I say the shield of so I call it the shield of health literacy, but really in that situation, it's the shield of plain language. Not only now, like GDPR and those type of things are kind of requiring that it be clear, but that's the reason GDPR and those type of changes, because we're actually having the California Consumer Protection Act, or Privacy Act, I think is what the P means, that takes into effect this 2020, January of 2020. Also, similar type of things is you have to make it clear so people can understand. That doesn't mean that they're necessarily going to click through, but if you don't give them the chance, then why, then you're not doing your duty. So I think of this more as our duty rather than, to give people the opportunity. That doesn't mean they're going to do that. I mean, we all do that, right? We get something in the mail or email and it's like, it's pretty clear, but I don't have the time to look through it. But if it's not clear, you're never going to get anybody to look through it. So I think of that as more of like the shield of liability. If my terms and connectors and other thing, or terms and connectors, I'm talking about legal research now, terms and conditions are very clear and understandable, and my informed consent forms are clear and understandable, and all of these other things, no matter what people do with it, if they just click yes, or they sign or whatever it is, we have a much stronger argument on the back end should we ever be sued for this, saying, look, we're doing things that are uber reasonable here. We're above and beyond the call of duty, so we should not be liable. But you can't make that argument when it's just the same old.
Yeah, indeed. And I think it is actually a legitimate fear that people could go forward and say the contract is invalid because it isn't written in a way that it actually, makes sense to the recipient of the contract.
Right, but that, yeah, and that taken, point taken though on that is like, we know the data says like 0.64% of the people actually read the terms and conditions, so less than 1%. So I get what you're saying, and so in some ways, like if it's you would, I would rather have you spend the time focusing on the document that 100,000 people in your organization are actually going to get and have to fill out first. If you had to say, okay, I can only do one or the other.
Yeah.
I do totally understand about kind of, prioritizing things, but if you're talking about culture change, then that's the reason for culture change, even for terms and conditions that may never be read.
Indeed. Now, let me see. We're nearly up to the top of the hour, but I want to see if we can get another question in here. Are there any inherent dangers with literacy in APPS and AI? Is there a way to mitigate this and still keep the logic? It's a bit more of a technology question.
Yeah, that's tough. That's a tough situation. There probably is, but I don't know if I know the answer. But that it gives us something to think about, though, about how do we do that? How do we still keep all of the logic that's there, on the back end, while making the front end, kind of much more accessible to people? I talk with a lot of ontologists, and kind of the in the health world about how do we create an informed consent ontology, and these other things, so we can create machine learning that kind of replicates things, and that kind of, they're thinking about these things. It's just hard. There's a lot of different decisions to make.
Yeah, and I think when it comes down to plain language and health literacy, you do need to actually have a human test and read and see, okay, does it work? And I think we have, here at VisibleThread, this is what we do. We work with AI and NLP to bring you a solution that helps you with technology to make things easier and bring in these workflows and create logic and make plain language a lot easier. But we will always say, you do need to read and think through. We're not replacing the human, we're not replacing the editor, and I think that's something to keep in mind.
Well, and then I know we're at the time. One last comment. How about that?
Sure.
So along those same lines is that, you do have to do a lot more user testing, for your higher, running just this test, just the readability tests and those type of, computer things are great, but things that work in, if you can work in user testing, how people actually receive this information. I do a lot of user testing with high stakes documents. When you got to this point, what did you think? So that's something I think that, a really good metric or measure will somehow weave that in some way. But that's yet to be determined how that's going to be done in the electronic world.
Absolutely. Indeed. Well, listen, Chris, I want to thank you so very much for joining us and sharing with us. Everyone who's on the call, thank you so much for joining our webinar. If we didn't get to your question, I will come back to you. If not tomorrow, then early next week with an answer. If you would like to know a little bit more about our healthcare report that we launched earlier this year, please head over to our website. You can download it from there. We had a couple of questions about where those figures come from and what did that look like. And I think, as well with the technology question at the end, if you want to have a look at the VT Insights platform, which is the solution that we use to run the report, have a look. There's the link there. We'll share the slides as well, so you get access to all the links, by the way. So, but follow through, have a look at the VT Insights platform, sign up for a trial, or please email us for a demo. We'd be delighted to show you the solution. And if you've got any additional questions at all for myself, please feel free to send me an email. I would be delighted to hear from you. Again, Chris, thank you so much, and everybody joining us, thank you so much for listening in. It was a real treat, a real pleasure, and I hope we get to do it again sometime, Chris.
Sure. Yeah. Thanks so much for having me. I really appreciate it.
It was great. Have a lovely, lovely day, and talk soon. Bye, everyone.